This video is for general information only and is not a substitute for advice from your GP or pharmacist. Always speak to a healthcare professional about your own treatment. So you're thinking about weight loss medicines, or maybe you're already taking one and you want to know what side effects to expect. That's exactly what we're covering today. Weight loss medicines can be genuinely helpful tools, but they work best alongside lifestyle changes like diet and exercise. And like all medicines, they can cause side effects. The good news is that most are manageable, especially when you know what to look out for. The most commonly reported side effects across weight loss medicines are gastrointestinal, so things happening in your digestive system. We're talking nausea, diarrhea, constipation, abdominal discomfort, and flatulence. Not the most glamorous list, but important to know about. The side effects you experience will depend on which medicine you're taking. Orlistat, available as Xenical on prescription, or Ali from a pharmacy, works by blocking fat absorption in the gut. Because undigested fat passes through your digestive system, it can cause oily stools, increased bowel movements, and what's called fecal urgency, meaning you may need the loo quite suddenly. Many people find these symptoms improve when they follow a lower fat diet, as advised by their clinician. Orlistat can also reduce your body's uptake of fat-soluble vitamins A, D, E, and K. So a multivitamin supplement is often recommended. Your prescriber or pharmacist can advise on the best timing for this. It's also worth telling your prescriber or pharmacist about all other medicines you take, including things like levothyroxine or warfarin syrup, as they may advise spacing certain medicines or monitoring you more closely. Orlistat should not be taken alongside some medicines, so always check with your clinician. Then there are GLP-1 receptor agonists, medicines like semaglutide, known as Wegovy, and liraglutide, known as Saxenda. These slow down how quickly your stomach empties, helping you feel fuller for longer. The most common side effect is nausea, and it tends to be most noticeable when you first start treatment or when your dose is being increased. This is why these medicines are introduced gradually to give your body time to adjust. It's also worth knowing that an oral version of Wegovy has recently been authorised in the UK and is currently rolling out on private prescription. Availability may change, so speak to your clinician about whether it might be suitable for you. One important safety point: only obtain weight loss medicines from registered UK pharmacies or NHS services. The MHRA has warned about counterfeit and unlicensed products sold online, particularly fake GLP-1 medicines, which can be unsafe. Now, most side effects are manageable. Staying well hydrated, adjusting what you eat, and following your prescribed dose as directed all make a real difference. Don't adjust your dose yourself, always follow the guidance you've been given. That said, some symptoms need urgent medical attention. Call 999 or go to A&E immediately if you experience chest pain, severe shortness of breath, or signs of a stroke. Contact your GP or NHS 111 promptly if you develop severe abdominal pain, which could suggest pancreatitis, or signs of liver problems such as yellowing of the skin or eyes, unusual fatigue, or dark urine. These are rare, but they're serious, and it's always better to act quickly. If you experience a side effect from any medicine in the UK, you can report it through the MHRA Yellow Card scheme at yellowcard.mhra.gov.uk. This helps regulators monitor medicine safety across the population. So, to recap, weight loss medicines commonly cause gastrointestinal side effects, which are often manageable with dietary adjustments and proper hydration. Different medicines work in different ways, so your experience will depend on which one you're taking, and always speak to your GP or pharmacist before starting or changing any weight loss treatment. If you have questions, drop them in the comments below. And if you found this helpful, give it a like and subscribe to the Bolt Pharmacy channel for more medically reviewed health information.